Hello, and welcome back to Medical Compliance with Clarissa. I'm Clarissa Benfield, our Global Director and Business Line Leader for our medical and laboratory business here at Intertech. And today I'm so thrilled to be joined by my colleague from our Satellite Data Acceptance Program, Tom Van Luven. Tom, thank you so much for joining us.
Yeah, absolutely. Glad to be here.
So happy to have you here today to talk all things data acceptance. So maybe to kick us off, you can tell us a little bit about yourself, how long you've been with Intertech, and how you work in the business.
Yeah, so I'm Tom Van Luven, Director of the Intertech Client Test Program Satellite. I've been with Intertech, this is going on my 17th year, and I've been managing our Client Test Program Satellite. This is the 7th year. And I'm actually based out of our Cortland, New York facility, which is one of our larger test facilities in North America.
Yeah, and I'm really excited today to talk to you specifically about data acceptance and client testing and what that means for our manufacturers, specifically medical device manufacturers. But maybe just, in general, we can talk a little bit about what it means when we say data acceptance, what it means when we talk about a client test program. There's a lot of different phrases that we use. So maybe you can just talk a little bit about what does that mean when we say data acceptance? What does it mean when we say client testing? What are we talking about?
Yeah, absolutely. It's a good question. Within our industry, we love our acronyms and different names. There's a lot of different names out there for client test programs, depending on what agency you're working with. But in essence, they all mean the same thing. What we're doing here is under a client test program, we're empowering manufacturers to conduct their own testing in-house. They go through an entry process, they're under surveillance, but in a nutshell, we empower the manufacturers so now they can do testing internally in their own facility.
Yeah, and it's, we call our program Satellite, which I love. I think it's a great name. I think it's a great meaning behind it, why we call it Satellite. So can you tell people a little bit about what our program is when we say Satellite?
Yeah, absolutely. It's actually a trademark name. In essence, we're making you an extension of us, right? So but at the end of it, once you're in the program, you are basically another Intertech test lab. So we really felt, the term satellite really kind of encompasses the meaning of the program because you are now a satellite of Intertech. So, and plus, it's a lot better than the other names. I think it's a lot more fancier. I'm a little biased, of course, but yeah, our program Satellite.
Of course, and we like to view those people in the program, as you said, as extensions of us, as satellites of our labs and facilities. So data acceptance, right, is something that I think now more than ever, especially, throughout COVID, post-COVID, we've seen manufacturers having a lot of challenges. And, we've seen a lot of challenges with things like supply chain. And I think now more than ever, a data acceptance program can really be beneficial, or the idea of being able to test within your own site or within your own test lab. So maybe we can talk a little bit about what we've seen kind of throughout this time with COVID. And now we're in this new post-COVID era, if we can even call it that, right? With, manufacturers utilizing data acceptance or utilizing the opportunity to test within their own facilities.
Yeah, it's a great point. I think COVID for a lot of us and for a lot of manufacturers brought awareness to them how dependent they are on various things. So I think a lot of manufacturers are now positioning themselves to take as much control as possible internally so they can kind of lead their own destiny. And that's exactly what Satellite does, our client test program does, is it allows the manufacturer to take control of that testing. So now the queue belongs to them. And any sort of challenges they face, especially with their suppliers, a lot of folks ran into alternate component challenges. A lot of their component vendors ran into material challenges. So they were constantly changing their components or having to source new components. And what Satellite allows them to do is take control of that component testing so they can react much quicker and be a lot more flexible when it comes to component sourcing, where previously they just kind of relied specifically on the manufacturer themselves. So yeah, I think COVID definitely opened up a lot of eyes to how dependent folks are on a lot of different things. So vertically integrating your own testing to be able to take care of certain challenges like your alternate components really helped out in expediting their certification process.
And I think what's interesting too, specifically for medical device manufacturers, many medical devices have tens and hundreds of components, right? So many components that go into these systems. And if they're dealing with these supply chain issues or supplier obsolescence, right, and constantly evolving and going through component changes, having that ability to do your own testing when you're making these changes or adding alternates can be really beneficial, especially when you have these systems that have just so many components that are within them.
Yeah, absolutely. Another key thing too, we saw a lot of activity is through live stream video. That became super popular
Mhm.
during COVID, and we continue to extend that service through the satellite program.
Yeah, so maybe talk a little bit about that. When you say live stream video, what is someone able to do utilizing, this type of technology?
So yeah, interestingly enough, during COVID, it got to the point, I'm sure as you're aware, we couldn't even go on to Intertech or
Mhm.
any client facilities because of COVID. So, we got very creative on our quality side and worked with our clients to set up live stream video testing capabilities. So folks can literally set up a live stream, conduct tests, and we can witness via live stream. Now we've always had live stream video capability in the satellite program, but I think it just became, a lot more awareness to that capability during COVID when we literally could not get onto anybody's facility. So that today continues to be a very desired service for a lot of OEMs to take, again, control of testing and kind
Mhm.
of take more control of the queue is through that live stream video capability. So yeah,
Yeah,
that is
absolutely.
something a lot of folks pursue.
Yeah, giving that flexibility. So I want to dig into a little bit, specifically looking at our medical device manufacturers. We know with medical, right, there's a lot of standards that apply. We have 60601, but that's just one of many. So when we look at a data acceptance program or we look at doing testing at your own facility as a manufacturer, as a medical manufacturer, do I have to test to 60601 and all the standards that are applicable to my product and able to be able to have data acceptance? Or can I do a portion of a standard or a standard? Like, how does that work when it's not just, oh, only this one standard applies for a product, or we have this suite of standards?
Yeah, it's a great question. As you know, there's a lot of standards out there. It's not all or nothing. You can certainly have, a partial scope within your program. Some folks will continue to have us perform certain tests because logistically it makes more sense, or maybe the equipment's just too expensive for them to invest in. And also, you don't have to have every single medical standard in your scope. You really just focus it on what your internal capabilities are and where you're going to get the most efficiency out of your program. So whether you're doing a handful of standards or only a couple, or whether you're doing the entire standard or only a partial scope of that standard, all of that is acceptable within satellite. You just really got to focus on what your internal expertise is, where you get the most efficiency, and then focus on making that your satellite scope.
Yeah, and I think what we see too a lot on the medical device manufacturer side as well, right? We see people who will do one of the particular standards, right? One of the part two standards, or just a portion of a part two standard, especially when we have these standards that require a lot of monitoring, right? Or you're testing over a course of time and you're taking data points and measurements, right? It's much easier in some cases for the manufacturer to be able to do that themselves, right? And provide that data back to us. So with these big complicated medical projects or ME systems, you're not required to do every single test yourself and provide us all that data. You can do a portion of it. And I think that really comes down to working with our satellite team, of course, and our local teams and understanding, right, what's the best test plan, always understanding that, we want to, make sure that we're coming up with a plan that makes sense for everybody. So I think that's one of the most beneficial things too, especially for a medical device manufacturer with a data acceptance program. If you have your own test lab, to be able to go through and test to some of the portions of part twos or some of the portions of the base standard. Yeah.
Yeah, it really depends on what makes sense logistically. And you could have a client that only has a few specific types of products launched each year. So they're really
Mm-hmm.
not doing a lot of testing in that particular standard. So they'll keep that testing with us. And then for their high volume activity or more of their
Mm-hmm.
products where they're constantly launching or having multiple releases each year, they're definitely going to have that as part of their satellite scope. So really, the OEM will take a look at themselves and determine what makes the most sense as part of their scope. But as far as the program requirements, it's very flexible.
Yeah, which is wonderful. And I think, one of the other things that people think a lot about or ask a lot about in terms of a data acceptance program is the actual schemes that you can apply under data acceptance. So I think it's pretty widely known and accepted that the NRTL mark is covered under data acceptance. So you have NRTL under satellite with our ETL mark. But are there other types of schemes or certification schemes? Since we know medical device manufacturers obviously oftentimes are testing to other schemes outside of just an NRTL marker and an NRTL scheme.
Yeah, absolutely. A lot of folks are doing it for North American safety, but in the satellite program, we have a lot of folks doing a lot of different things. So whether it's
Mm-hmm.
international compliance for CB scheme, conformity reports for CE, EMC testing, energy efficiency, performance, you name it. If the client has that test capability, we should have the discussion if it makes sense to be in the satellite scope. Because again, we have a lot of folks doing a lot of different things, and the program certainly covers a lot more than just North American safety. So it's a great point.
And I think especially for medical device manufacturers, right, we do see a lot of people go the CV scheme route, right? We see a lot of people, of course, who are manufacturing medical devices and shipping them all over the world and wanting to have a CV certificate or having their own EMC testing capabilities. So understanding that you may have some additional legwork, right, in terms of audits and pre-work that you have to put together. But if you have those lab capabilities, if you have that set up, there's a lot of different schemes that can be included under the satellite program.
Yeah, a couple of key things regarding medical. A lot of our satellite members under medical actually have that EMC capability in-house. So they actually have that EMC testing internally as well as the safety testing. Mm-hmm. And also the nice thing about medical, as you're aware, a lot of the standards are harmonized. So, once they get through that bulk of testing, they can apply that to a lot of the different schemes, whether it's for CE or just for North America. Mm-hmm. So what I mean by harmonized standards, you have one standard that covers all the different markets. So whether it's North America, Europe, CV scheme, it's one base standard, which is nice. So it certainly makes sense if you're going to take control of your testing under medical and it's a harmonized standard, try to capture as many schemes as you can internally, right, to get the biggest bang for your buck, so to speak.
Absolutely. And I think, we see oftentimes with medical device manufacturers, they'll have their own labs already or some level of a lab set up, right? And obviously you're going to have skilled and qualified personnel. So when we look at a data acceptance program like Satellite, what are some of the preparation requirements if someone says, okay, we have our own test lab, what do we need to prepare for? Are there audits, annual audits? Like, what does that look like from an actual getting into the program standpoint for a medical device manufacturer?
Yeah, it's a good question. So all of the requirements for the satellite program are based off ISO 17025. That's your international standard for test labs and calibration labs. So, once you get into that program, we come in to do an initial assessment. So you'll have to go through an actual audit, which is in accordance to 17025. So we're looking at your internal lab quality documents, like your lab quality manual, calibration certificates for all your test equipment, the various CVs and resumes for folks that are doing the testing. So there's a lot of different components on the quality side that we're looking at in order for a client to get qualified as a satellite lab. And the nice thing with Intertech is we can work with that client from step one and train them and kind of educate them on what all these requirements are. And in fact, we also offer what's called a pre-assessment option where we can come out and do a mock audit, identify all the gaps, wherever it may be, whether it's in equipment or quality documents, and then over time help you fill those gaps. So when we come back for the formal assessment, it goes very smooth. So at the end of the day, it is a partnership. As I mentioned, we are in essence making you an extension of us. So we're going to partner with you from the very beginning and walk you through each step. So when we do have you officially as a member, you're running just as if you were another Intertech lab. But for getting into the program, as I mentioned, you have to go through that initial qualification assessment, which is in accordance to 17025. We also go through what's called the confidence building period, where we actually witness them conduct their own testing to verify their internal competency and knowledge of the standards. And then once they go through that, they're pretty much in the program, and we send them through an onboarding process where they get fully acclimated. And then each year you go through that same audit. So there is a reassessment each year in accordance to 17025. But once you get all the quality documents in place and all the procedures in place, it's pretty much just a reassessment at that point, unless you're doing scope expansions where you're adding new standards or adding new personnel. Then we can come out and do special audits to make those transitions as needed.
Yeah, and I think that's another point, right, with COVID and what we've seen in the job market and, right, people transitioning out. There is a lot of update that we've seen with personnel, right, people leaving organizations or new people joining or want to qualify more test engineers under the program. So we do have that flexibility as well if people have turnover within their teams or they need to add more people or if different people handle different things, right? We do go through that process of qualifying the technical expertise as well, right? So we look at the equipment, calibration of equipment, all of those things, but also look at the personnel on an ongoing basis so they can be updated and changed. And you can have different people who have different skill sets who are working under the program.
Yep, absolutely.
Yeah, which makes a lot of sense. So I think, just in general too, when we're talking about a medical device manufacturer, one of the things that we sometimes hear, right, is people are a little bit nervous or hesitant or apprehensive to do everything themselves, right? They still like to have the idea of having a test lab have final say, right, and sign off on the reports and issuing the reports. So maybe you can talk about those distinctions a little bit. I know we have some manufacturers who are in the satellite program or in a data acceptance program who really love the flexibility of doing everything themselves all the way through to issuing the reports. But as I said, sometimes with medical device manufacturers, maybe there's not the desire to take that step of being the ones to actually issue the reports.
Yeah, it's a good question. The satellite program is set up into different levels. So really you want to take a look at what the manufacturer wants to take control of. Do they want to just focus on testing and then we continue to do the construction reviews and write the reports?
Mm-hmm.
They want 100% control where they're doing the construction review, performing the testing, and writing the report. So we do have different levels that the client can come into the program based on their needs. And what Intertech will do is we'll create that roadmap based on what their goals are and get them set up in that appropriate level. So, we have as I mentioned, the different levels. You got satellite level 3 enhanced. That's where the majority of our members reside, actually. So this is where they're doing testing unobserved, but we're still doing the construction review and writing the report. So they can really just focus on testing. Then we have those that have a lot of resources internally. They want complete control. So they're doing basically 95% of the process. They're doing the construction review, they're writing the reports, they're doing the testing. We're simply acting as a reviewer. And then depending on how much control they have and how much they're doing will determine how quickly they get their certifications. So, it is a flexible program. As I mentioned, it does come at different levels. So we really look at what your internal expertise is, what your goals are, what do you want to take control of? And then from there, we determine what level makes the most sense.
Yeah. So for a medical device manufacturer, with what we're seeing right now with these supply chain challenges overall, with staffing issues or with needing to get products out quicker, there are really, advantages and things that could really come in a really handy for a medical device manufacturer during this time.
Yeah, absolutely. Yep.
Yeah. Anything else before we end our call today that you would like to share about the satellite program or data acceptance or the benefit for a medical device manufacturer?
Yeah, at the end of the day, if you have testing capability in-house, you've been doing testing for a while, you've been thinking about getting into a client test program, it's worth having that conversation to determine if it makes sense. And we can kind of walk you through every step of the way. And, if you are doing a lot of testing internally, it's best you take advantage of that and try to take more control of your certification process so you can get your products quicker to market. So we can help them at any step of the process.
Well, really interesting stuff, Tom. I really appreciate you joining us today. If anyone has questions, of course, they can reach out directly, and we're happy to set up a conversation with Tom and his team. Really appreciate the discussion. Hope you have a great day.
Thanks, Clarissa. Take care. Bye-bye.